Most people with back pain end up using either heat or ice at some point, but very few actually understand what each one is doing or when they should be used. Let's start with ice. Ice is typically used to reduce inflammation and numb an area. It can be helpful in the very early stage of an injury, particularly if there has been a sudden strain or irritation. Applying ice can temporarily reduce pain and help calm things down. But back pain is not always driven by inflammation. In many cases, especially after the first few days, stiffness and muscle tension play a bigger role. This is where heat often becomes more useful. Heat helps relax muscles and increase blood flow to the area. This can reduce stiffness and make movement feel easier. For many people, heat simply feels more comfortable. This is why heat is often preferred for ongoing or persistent back pain. It doesn't fix the problem on its own, but it can make symptoms more manageable. A common mistake is relying on either heat or ice as the main treatment. They are both symptom management tools, not solutions. They can help reduce discomfort, but they don't address the underlying issue. Another mistake is overusing them, leaving heat or ice on for long periods or using them repeatedly throughout the day doesn't necessarily speed up recovery. Short, controlled use is usually more effective. So how do you decide which one to use? A simple guideline is this. If the pain is very recent, sharp, and irritated, ice may help settle it in the short term. If the pain feels stiff, tight, or ongoing, heat is often more beneficial. But the most important factor is your own response. If heat feels better, use heat. If ice provides relief, use ice. The body often gives you a clear indication. It's also worth noting that some people alternate between the two. This can work, but again, it's about symptom relief rather than treatment. The bigger picture is what matters most. Movement, gradual loading, and consistent activity are what drive recovery. Heat and ice can support that process, but they don't replace it. If you rely solely on passive methods, progress is often limited. But if you use them alongside the right level of movement, they can make the process more comfortable. The key takeaway is simple. There is no single correct answer for everyone. Heat and ice both have a role, but neither is the solution on its own. Understanding when and how to use them allows you to manage symptoms more effectively while focusing on what actually drives recovery.